Broadcast is now starting. All attendees are in listen-only mode.
Good morning, everybody. Good day, and welcome to our spring webinar series. And I'm happy to say it's now spring, so it's it's certainly an exciting time. This time a week ago, there was still lots of ice on the roads and on the driveway for sure. But anyways, we're back in spring now, so welcome everybody. Welcome. First of all, thank you very much for attending. We're going to spend close to an hour together today, and I want to take this opportunity on behalf of all of us here at the Benefits Trust to say thank you very much for attending. We don't take that lightly. We want you to learn something at this session today. We want you to get value out of this session today, but we also want to thank you very much for attending. The Benefits Trust was established on January 1st, 1994, so close to 25 years ago. I actually should say that we have our first client effective January 1st, 1994. So the Benefits Trust was certainly established 25 years ago. We're a full-service third-party benefit administration company, and we work directly with brokers like yourself. We do not sell direct. We work with brokers like yourself. At the end of the presentation today, you're going to get a very short survey that we'd like you to fill out. Send back to us your response, because we always want to do things better tomorrow than we did it today. So that's really the goal there, as well as to get some feedback from you on some future ideas that you'd like to see covered in webinars. Honestly, folks, it's about 5 or 6 questions long, so please take a moment to fill that out. In addition to that as well, you'll be signed up for our Trusted Advisor newsletter, and we encourage you to visit thebenefitstrust.com for lots of valuable information and go on the Advisor Resource Center. There's tons of valuable information, including our healthcare spending account eBook, which is on there as well. You will be getting a CE certificate for attending today, and it looks like we've got, close to 50 people online. So that's exciting. So we're going to be sending out those CE certificates in the next couple of weeks. So sit tight. It's going to be a lot of fun, and we're going to talk about healthcare spending accounts today. My name is Robert Crowder. I'm the guy on the left-hand side here, and I'm the president of the Benefits Trust and the founder of the Benefits Trust. Mike Ignatz is generally here with us as our moderator today, but I'm flying solo. So if you have any questions throughout the session today, type them into the question box. I won't be able to answer them directly like Mike does, but I will answer them either offline or certainly throughout the remainder of this presentation. You can also reach out to Mike or myself at the office. Mike is just unfortunately not available to attend today as he's got other commitments. But we're certainly here to help. You can also reach out to Carrie Lane in our office as well for any information. So let's get to it. We're talking about today healthcare spending accounts and where do healthcare spending accounts fit into the benefit world. And it's interesting because healthcare spending accounts have really had a ton of traction over the last number of years, and they're becoming more and more popular as part of benefit programs. So really what we want to talk about today is healthcare spending accounts, but also where do they fit in the benefit world? And the question that comes up is, what kind of conversations are you having with your clients? It's as simple as that. It's, how are you bringing up healthcare spending accounts, and what types of conversations are you having with your clients? One of the things that I always say or often say when I'm with an end user client, when I'm with a broker and an end user client, is what is a benefit plan? And it's really interesting. And those of you that have heard me speak before have heard me say this, but I'm going to repeat it again for the new folks. Is this was an aha moment I had a number of years ago. I was in an interview with a broker and a client, and the interview was simply not going well. It was really sort of going off the rails. You've had those interviews and you're talking to somebody and it's just oil and water. It's just not jiving. And I could see the client getting more and more frustrated. And we're only about 10 minutes into the meeting, but you can see him getting frustrated because he wants value for his time. And I could sense that it was going offside. And I said, "Hey, Mr. Client, what is a benefit plan?" And he looked at me still with that pissed off look on his face. And he looked at me and he says, "It's the health and dental. It's what we're talking about here. It's the group life insurance." And I said, "No. What is a benefit plan?" A benefit plan is nothing more than a promise between an employer and a group of employees. And it was interesting when I used that word promise. It's a promise between an employer and a group of employees. This particular guy was the boss. He was the owner of the company. He was the employer. He viewed himself not as an employee. He viewed himself as the employer. And you could see all of a sudden his body language change during this meeting. His body language changed. And he goes, "Yeah, I get it now. I can promise my employees anything I want. I can promise my employees anything I want with respect to benefits. So it was a very powerful word that I used, and I've been using it ever since with significantly positive results. So a benefit plan is nothing more than a promise between an employer and a group of employees. And yes, the group of employees can be one employee. So for example, all people in the research and development section of this company get this type of benefit plan. Well, there may only be one person in the research and development department of that particular company. Or all presidents get this company or this benefit plan. Or all administration folks with 15 years of experience or more get this type of benefit plan. So the group can be one employee, as long as all employees within that class are treated the same. So benefit plan, a benefit promise, is just a promise between an employer and an employee. That promise often consists of three components. Keyword there is often. It doesn't necessarily have to always consist of these three components, but it often consists of these three components. Insurance, reimbursement, and administration. There are three different components, generally speaking, that make up an employee benefit program. Again, insurance, reimbursement, and administration. So traditional plans, what we're finding out there, traditional plans are making clients frustrated. It's really interesting because I've spent a lot of time with clients over the years, and I've been doing this for, well, the Benefits Trust for 25 years, but I've been a licensed insurance agent for 30 years this August. And traditional plans are making clients more and more frustrated now. It's interesting. I was in an interview a couple of weeks ago with one of our existing longstanding clients, actually a client we've had for 25 years. And he goes, I don't know what's going on in your industry, but we're getting calls all the time, and it's frustrating. And traditional plans are making clients frustrated. This particular client's not frustrated. He's just frustrated because people are calling up and making these crazy promises. Oh, I'll save you 30% on your premiums, or we can save you 10 or 15% and lock in your premiums for 3 years. They're making crazy promises without even understanding what their benefit plan is, and it's causing a great deal of client frustration out there. And as a result of that, clients are making advisors frustrated. I'm sure many of you have been sitting sitting at your desk, and right out of the blue, you get a termination notice. You get a notice from your client that they said, hey, they've signed an AOR and they're moving in a different direction. You're sitting there going, hey, what's going on here? And you talk to the client, and they say, yeah, somebody came in and gave us a quote, and it's 25% less, so we're going to move on with them. So all of a sudden, clients are making advisors frustrated as well. And a lot of people are getting into this business, but a lot of people are saying, hey, this is a frustrating business. There's no loyalty. People are just shopping the market. There's rate whores out there, as I like to say, and it's making everybody frustrated. But one thing that I've always said as well is client frustration is often the raw material for creative solutions. Client frustration is the raw material for creative solutions, as simple as that. So are healthcare spending accounts the solution? Well, the answer to that, I can tell you right off the top, is absolutely not. Healthcare spending accounts are not the solution. Healthcare spending accounts are a solution. So are healthcare spending accounts the solution? No, they're not the solution. They're a solution. Why are healthcare spending accounts becoming so popular? Well, the fact of the matter is many large companies have healthcare spending accounts. My sister, for example, works for the Royal Bank. My brother works for Bell. Two big companies, huge Canadian companies. And it's interesting because we were at Thanksgiving, this is a number of years ago, and we were talking about my niece's new braces. And she was, showing off the new braces that she had in her mouth. And I think my brother said to my brother-in-law, what do those cost you, Tom? And Tom said, I don't know, because Mary and my sister and I have healthcare spending accounts as part of our benefit programs. And as a result of that, we were able to pay for the majority of the cost through our benefit plan. So a lot of large companies have healthcare spending accounts as part of their benefit plan. So it's interesting when you've got employees at Bell and employees at the Royal Bank having healthcare spending accounts. A lot of their spouses work for smaller companies potentially, and they're asking for them. So healthcare spending accounts are becoming a big part of benefit plans. So it's just a part of the benefit plan. So first and foremost, what is a healthcare spending account? Well, it's quite simple. A healthcare spending account is a predetermined amount of money provided to an employee at the beginning of a benefit year to cover their medical and dental expenses. So it's a predetermined amount of money provided at the beginning of the year. So you're going to make an employee a promise that says, hey, Mr. Employee, we're going to give you $1,000, for example, or $1,500 or $2,500 into a healthcare spending account that you can use to cover your family's expenses, your and your family's expenses throughout the next benefit year. So I like to say it's a bucket of money. It's as simple as that. A healthcare spending account is nothing more than a bucket of money. The employer determines how full the bucket is, and then the individual employee and their families can withdraw money from that bucket as long as they are eligible CRA expenses. And depending on how the healthcare spending account amount or healthcare spending account is set up, unused account balance can be carried forward into the next benefit year. So healthcare spending account is just that predetermined amount of money. It's a promise that the employer makes to the employee or the group of employees that says, you're going to get this much money for the next 12 months to use in your healthcare, to use for your medical and dental expenses. It's as simple as that. So as I like to say, a predetermined amount of money sounds an awful lot like a defined contribution pension plan or a group RSP. It's a predetermined amount of money. We're going to give you X percent of your salary, or we're going to give you $1,500. It's a defined amount. It's a defined contribution. So healthcare spending accounts can be a part of an employee benefit program, certainly not the whole thing necessarily, but healthcare spending accounts can be a part of an employee benefit plan. So the question is, how big is the part? So how much do you want to give each employee or each employee within a class? It really determines on a number of factors. So when we look at the benefit spectrum, if you would, you've got a defined benefit pension plan on one end of the a defined benefit plan on one end of the spectrum and a defined contribution benefit plan on the other end of the spectrum. A defined benefit plan would be more like a conventional plan. A defined contribution would be more, or it is, a healthcare spending account. So the question is, where does a healthcare spending account fit? It depends on where the employer really wants to combine the conventional plan and the healthcare spending account and where they want it to fit on the line. So without a doubt, a conventional plan, more of a traditional type of looking plan, where you've got so much life insurance and so much long-term disability insurance and an extended healthcare benefit and a dental care benefit, that's a defined benefit plan. That's a conventional plan or a traditional plan. And the insurer sets the premium. The insurer is in complete control of what that plan costs. Simple as that. When you've got a healthcare spending account with a defined contribution plan, the employer is in complete control. So depending on how or where you want to put that healthcare spending account on that spectrum will determine how much the employer has control and how much the insurer has control. So when we look at a defined benefit plan or a defined or a traditional benefit plan, the benefit is clearly defined. It's defined by a set of premiums that are set annually by the insurance company to cover future insurance risks, routine expenses, and administration costs. This is a conventional benefit plan. This is a traditional benefit plan. The premiums are set by the insurance company. Yes, you as the broker may be able to negotiate those premiums. You may be able to search the marketplace and find somebody with cheaper premiums, but the insurance company sets those premiums. It's as simple as that. And when we look at those benefit plans, as we all know, it's life insurance, AD&D, long-term disability, critical illness, extended health, and dental. The control is very much in the insurer's hands. Simple as that. When we look at a defined contribution plan, the contribution is defined, or the healthcare spending account amount is defined. The contribution amount is set annually in advance by the plan sponsor. Therefore, the plan sponsor has the complete control. The control is in the hands of the employer. The control is in the hands of that person making the promise. Again, that promise. So nobody's telling me, if I'm making the promise, how much I have to do or how much I don't have to do. That's my choice. So it's very much in the control of the employees. So back to healthcare spending accounts and how do we start the conversations with our clients is critical. So you're having a conversation with your client, you're talking about healthcare spending accounts generally speaking, or you're talking about benefits. One question that I like to ask very early on in an interview, and it doesn't matter if the company has 5 employees or the company has 50 employees or the company has 500 employees, it really doesn't matter. But when you're talking to an employer, you're saying, hey, Mr. Employer, what are the groups within your group? And especially if you've got 5 or 6 or 10 employees, which the majority of Canadian businesses operate under, they've got very few employees. You say, what are the groups within your group? And they might look at you like you've got 2 heads. You're saying, what are you talking about? Well, what are the groups within your group? You've got the owner of the business, You might have someone that's a key integral part of the business, has been with you for many years. And you might have 2, 3, or 4, or 5 people that have been with you just a couple of years, and they're more of your workers, if you would. So you've got a ownership class, a president's class, ownership class, management class. You've got a key person class, and then you've got an employee class. So it's interesting. What are the groups within your group is a very powerful question. And then what we say is you might want to determine your spending budget by group within the group. So you're getting the employer to think a little bit differently about the future of their benefit program, and you're looking at the different compartments, if you would, of that promise that they're making as a whole. So you're saying, okay, let's look at the different groups within the group and say, hey, great, what do we want to spend on the executive group? What's the budget for the executive group? What's the budget for the new employee group? What's the budget for the people that are easily replaceable group? What's the budget for the people that have been here for 10 years or more? What's the budget for the sales group? What's the budget for the R&D group? What's the budget for the professional group, the engineers, or what's the budget for the lawyer group? So it's determining the benefit spending budget according to that group within the group. And it's a really interesting conversation you can have with your clients, because when they think about it, if they've got an existing benefit plan that is the same for everybody, it's a conventional plan, and let's just assume for a moment the premiums average out at about $3,000 per person. And you've got 5 people in the group, and somebody making $25,000 and someone making $250,000. One way to look at it is, the costs are $3,000 per employee. That's actually discriminatory against the executive employees, because more of the premiums are going to be used for the employees that make less money in a percentage basis than the executive group. So I'm spending $3,000 on benefits for myself, and I'm making $250,000 a year, and I'm spending $3,000 a year for benefits for someone that's making, for example, $36,000 a year. A larger percentage, greater amount of benefits and compensation is being used on that person that's spending that or earning that $36,000 a year. So how is that fair? So it's about determining the appropriate benefit spending budget by group within the group. Second component is decide how big of a role you want the healthcare spending account to play in your plan. How much flexibility do you want to give your members? Rather than choosing between a conventional benefit plan and a healthcare spending account, provide a basic core benefit plan complemented with a healthcare spending account. It's interesting, and especially with smaller groups, we're talking to people all the time, every day. We're talking to people about this and brokers about this, and they go, oh, so if I don't want to have a conventional plan, can I just have a healthcare spending account? We're saying, well, you can, or your clients can, more importantly. But you know what? Maybe you want to set up some type of a hybrid plan. It's not either or. And a lot of brokers think that it is either or, and they're having conversations that, hey, if you don't like this conventional plan, the other opportunity is a healthcare spending account. That's not necessarily the case. You can choose between the conventional benefit plans and a healthcare spending account, but you can also choose on how big of a role you want that healthcare spending account to play. As I mentioned earlier, a lot of big companies have a healthcare spending account as part of their benefit plan. So rather than choosing between the two, saying how big of a part you want that healthcare spending account to play. And some people want that part to be very large. Others want it to be very small. You know what? We just want to give everybody a $500 healthcare spending account. We want to give them a core drug plan, and we want to give them a basic dental plan, and here's a $500 healthcare spending account. Great, easy. Whatever it is that the client makes sense. So they're determining their budget, and then they're by group within the group, and then they're determining how big of a role they want a healthcare spending account to play. And then the third thing we like to say is make it meaningful. Make it meaningful to the company. So for example, a healthcare spending account can be a percentage of employees' earnings or a percentage of new sales revenue for the sales team, for example. A healthcare spending account can be a minimal amount for new employees and a larger amount for employees you want to reward and retain. It's entirely up to you. We've got a lot of companies that say, hey, great, all administrators get $1,000, all management folks get $2,500, and all senior executives get $5,000. That's just an example. But one company that we've been working with for many, many years, and we started this opportunity with them, and it was a very interesting situation. But their compensation philosophy was quite simply, we want everybody to have exactly the same benefits. And I'm looking at them looking at the situation, and I'm reading the general manager's eyes, and he's going, yeah, it's a real drag, but our compensation philosophy is everybody has to have the same benefits. So again, the lower paid employees are getting more rewards than the higher paid employees. So I said, well, they have to have the same, but do they have to be equal? And he goes, they just have to be the same. And I said, terrific. Why don't we set up a benefit plan that has more of a flexible component in the benefits? So in other words, let's put in a stripped down core plan and put in a healthcare spending account. And why don't we make the healthcare spending account a percentage of everybody's January 1st earnings? So people that are making $100,000 a year and people that are making $50,000 a year and people that are making $25,000 a year have the same benefits, but there's just different amounts going into their healthcare spending accounts. So it was interesting because all of a sudden, again, you could see that general manager's body language changed. And he said, we'd have to have 75 or 80 or however many people were at the company at the time, different healthcare spending account amounts. And I said, yeah, that's not a problem, because all we do is we administer promises that employers make to employees, and that's not a problem at all. Anyways, we got the account. We've had it for many, many years. And it was an interesting situation because it's actually a German company. And there was a worldwide study done. I think it was done by William Mercer. This is a couple of years or a number of years ago. And there was a worldwide compensation study done by William Mercer. So in the Toronto office, they got a note, or the Mississauga office, they being William Mercer, got a note that they had to go and do a study for this particular organization. So the Mercer rep goes into the client based on direction from the company's head office and says, we need to get particulars to do with your benefit plan and your pension arrangements. So the booklet was handed over, and he was saying that it's impossible. It's impossible that you would have 75 or 80 different healthcare spending accounts. And he goes, no, that's the way we work our plan. He goes, no, it's impossible because no insurance company can do that. They can't administer it. And we said, well, or the client said, well, we've are using the benefits trust, and they certainly can handle that type of an arrangement. Anyways, it certainly passed the test, and the benefit plan is in place, and it has been in place for many years and works for them. So the only decision that the client has to make is what the percentage is that goes into their healthcare spending account, and is that reasonable given their current environment. So make it meaningful. So we talked about the groups within the group. What's the budget for each of those groups within the group? How much of a role you want the healthcare spending account to play? And we're saying make it a meaningful number for the client, so it's all, so it's exciting for them. The other thing we say is highly paid executives or highly paid employees should have all of their medical and dental expenses covered by a benefit plan, not just a portion of them, all of them, because it's a tax deductible expense to their business and they receive the benefit tax free. So if little Johnny and little Mary, the twins, need to get braces and they cost $6,000 each or $12,000, the executive wants to make sure that that $12,000 orthodontia expense is paid for through the benefit plan, as opposed to paying for it with after-tax dollars. The executive would have to earn $24,000 in order to have $12,000 left to pay the orthodontist. So highly paid executive employees should have all of their expenses covered by an employee benefit program or a healthcare spending account, or a combination of both. The other thing is, where we've used healthcare spending accounts and executive benefit plans quite a bit, is C-suite executives should have or can add on a healthcare spending account without disrupting the existing plan. An example of that is we've got a number of examples of that, but one example that comes to mind is we've got a Canadian company that all of you would know, or I'm sure the majority of you would certainly know. And it was really interesting because the agent, the broker that we were working with on this particular account, was sitting beside the CEO on an airplane coming back from Florida, and they were sitting in business class, and the CEO was talking about the problem that he has and how expenses aren't covered under his benefit plan. And her comment back to him was, well, you just don't have your benefit plan set up correctly, and as a result of that, we got a meeting. And this was a one-meeting sale, as I like to say. We went down and we met with the CEO of this particular organization and the chief financial officer of this organization. And we said, hey, we need this, or they said to us, we need this problem fixed, and we need this problem fixed quickly. and we really do not want to disturb our existing benefit plan because there's about 500 or 600 people in that plan. And I said, great, let's just add a layer of icing. Let's add a C-suite executive benefit plan, layer of icing on top of this plan where it covers everybody for healthcare spending accounts over and above their plan. The healthcare spending account is the last payer, so they use their existing plan first, and then they use this plan over and above it. And anyways, for the 6 C-suite executives, the premiums or the contributions into the healthcare spending account are in excess of, actually they're in excess of $200,000 now. So it's pretty exciting. So you can certainly do that just by adding that layer on. So healthcare spending accounts can be used in a number of creative ways. It was interesting. This agent, or broker, pardon me, again, met this person on an airplane. We had a half an hour meeting with them. We showed them a great solution that didn't disrupt their existing benefit plan. And we had the credentials behind us, and the client has had this benefit plan for a number of years. Out of human resources hands, and it works extraordinarily well. So adding a layer can be a great way to set up a healthcare spending account group for your particular clients. What if my client only is a group of 1 or 2 people? We get this question an awful lot. What if my client is only a group of 1 or 2 people? There's an awful lot of businesses out there that are independent businesses, and they might have a number of different clients, but it's a group of 1 or 2 people. And the answer is no problem. Sell them a benefit plan. We often get the question about shareholder benefits. Is this going to be deemed a shareholder benefit? Well, we say, hey, great, not to worry, because if you offer all of your employees a benefit plan, then it's not deemed a shareholder benefit. If the only employee is that of a shareholder, right, but they're a T4 employee, then it's not a problem. So if the employer if the employer and the employee are one, but he's also he or she is receiving a T4 income, that's not a problem. If the employer is setting up a benefit plan for example, if I was setting up a benefit plan for myself, but I didn't include any of the staff here at the Benefits Trust, that can be deemed a shareholder benefit. But I can set up a benefit plan for myself and include all of the staff or the majority of the staff here in my benefit plan, and it wouldn't be deemed a shareholder benefit. So as I like to say, if you got a group of 1 or 2, sell them a benefit plan. Again, that benefit plan has 3 components: insurance, reimbursement, and administration. As simple as that: insurance, reimbursement, and administration. You're selling them a plan. They're an employer and they're an employee. They've got T4 income. You're selling them a benefit plan that has insurance, reimbursement, and administration. Now, the insurance that you can get in a benefit plan for 1 or 2 people is somewhat limited. You're certainly not going to get $500,000 of group life insurance because there's only 1 or 2 people in it. But you can certainly get out-of-country emergency travel coverage with 60-day coverage from first dollar. And you can get in Canada large amount pooling or in Canada catastrophic coverage or stop loss coverage set at a $5,000 attachment level. So you can have an unlimited drug benefit, but with a $5,000 large amount pooling amount in it. So any drugs over $5,000 are covered by insurance. So that's the insurance you can offer. Reimbursement is covering all of the CRA expenses and in a healthcare spending account. So you can have out-of-country emergency travel coverage, you can have the large amount pooling, and then you can have a healthcare spending account that the employer determines the amount, the promises made between the employer and the employee. And then administration is handled by the Benefits Trust. That's what we do, is we keep promises that employers make to employees with respect to their benefit plan. So the advantage that we bring to the table at the Benefits Trust is the plan sponsor contributes monthly, but the promise is adjudicated on an annual basis. So the plan sponsor contributes monthly and the promise is adjudicated on an annual basis. So let's say you've got a group of one. It's a lawyer, or it's a doctor, or it's an insurance broker, or whatever this contractor, whatever the client is. They can, and let's say the employer wants to make the employee a promise that says we're going to give you $12,000 in a healthcare spending account, and the employee says thank you very much. Terrific. The employer is contributing $1,000 a month into that healthcare spending account. At the Benefits Trust, we will adjudicate it on an annualized basis, which means even though they've only contributed $1,000, if they have a $3,000 claim in month 1, we're sending them a check. We're sending the employee, the member, a check for that whole $3,000 amount. So they don't have to keep on coming back every month and making future claims. So the advantage that we bring to the table at the Benefits Trust is the plan sponsor contributes monthly, but the promise is adjudicated on an annualized basis. We've got a healthcare spending account plus plan, and I'm happy to say this is the last time you're going to see this because we're just in the final stages of redoing this document and redoing our executive benefit plans for small, profitable entrepreneurs. So this is the last time you'll see that, but a lot of the components are the same. And the best part about this solution is it has a fillable worksheet. So you can go online, or your client can go online, or more importantly, you can have a meeting with them where they're in their office and you're in your office, and they can fill out the worksheet online, and you can find out exactly what the costs are going to be. So the sample CRA expenses include things like prescription drugs, eyeglasses and contacts, orthodontia, group medical appliances, excuse me, custom medical appliances, private duty nursing, medically required private school tuition, rehabilitation programs. The list is significant. So some of these expenses can be extraordinary. Some of these expenses can be significant. So, for example, orthodontia. We were talking about, orthodontia a few moments ago. It can be easily $6,000 $8,000 depending on the type of orthodontia one's getting. Custom medical appliances. My youngest son was playing lacrosse at school this year, and he had an injury during a practice and tore his meniscus and tore a ligament in his knee, and he's quite active, quite an active boy, and he has to get a custom knee brace in order for him to not injure his knee further. And that custom knee brace might be $1,500. So it's a matter of getting that custom knee brace made for him. So it's that custom medical appliance. Medically required private school tuition, something that's very powerful. You've got an employee, or excuse me, a son or daughter that is got an independent education plan, an IEP, and there's a school that will assist them with that, and there's a tuition associated with it. It can be a life-changing event, and they can attend that school, and that expense can be covered under a benefit plan. So we're seeing claims that might be $30,000 or $40,000. Rehabilitation programs. Hey, we all know people that have got either spouses or children that have gone into rehabilitation programs for one reason or another, and we've seen expenses that are anywhere between $30,000 and $90,000 depending on the length of the rehabilitation program. Unfortunately, in rehabilitation programs, there are very few Ontario-funded beds, so this is something that's an opportunity. All of these expenses can be covered under a benefit plan. So it's important to note that all healthcare spending account contributions and administration fees and taxes are tax-deductible business expenses, and all benefits are received tax-free by the members. So all of a sudden, you got somebody, they've got a child with special needs, and they want to go into a private school that specializes in dealing with folks. They've got dealing with folks with those special needs, or they've got a son or daughter or spouse that needs some rehabilitation. Whatever the expenses are, they can be significant, and all the contributions are tax deductible to the business, and the benefits are received tax-free. So it's a tax-effective way to pay for these things. So again, when we're talking about those smaller employers, you got the employer hat on, you got the employee hat. A benefit plan is nothing more than a promise between the employer on the left and the employee on the right. Often they're wearing the same hat. So show your clients how you're going to pay for things that they're going to buy anyway with tax-effective dollars. So again, you can have an employee benefit program. If you've got a company or a client that's got 15 employees or 25 employees, it doesn't really matter. You can have a healthcare spending account as part of a benefit plan. And if you've got an employer that has just himself or herself and maybe one or two other employees, you can have different healthcare spending account amounts going into each of those classes. But you can set up a plan that might have a fairly significant healthcare spending account for the one particular employee and not quite as a significant benefit or an amount for another employee. So you're going to show your clients how to pay for things that they're going to buy anyway, but just with way more tax effective dollars. So how much can a plan sponsor contribute? Well, as much as required, as much as reasonable. It's not up to us to determine to say, hey, as long as there's incorporated and there's T4 earnings, you can have a healthcare spending account to the amount that makes sense in your organization. Who are we to say? It's up to you or your plan sponsor to determine what is required. So as we often say is estimate what your annual family expenses are going to be, add 20% for buffer zone, and away you go. Right? So I've got 3 kids, 2 of which are still covered under our benefit program. Right? And, we all go to the dentist. My wife has adult orthodontia. There's some expenses associated with that. She gets a massage every couple of weeks. It's fabulous, right? We all go to I mentioned we all go to the dentist. We have some prescriptions. We estimate what our family expenses are going to be, add a 20% buffer zone, and that's what our budget is. Simple as that. And we can do that by class of employees. So again, you can say, hey, great, I want a $10,000 healthcare spending account for myself and for my one key employee in this organization that's got more than 10 years of service. Terrific. We're going to give them a $2,000 healthcare spending account. Simple as that. Here's an example that we put together. You can say, for example, we want to say all executives get $10,000, all full-time employees with 3 years plus get $2,500, and all full-time employees with less than 3 years get $1,000. And again, that's just an example. Simple as that. It's just an example, but you can set up different buckets for different classes of employees. This might be a 3-person group. This may well be a 3-person group. So there's one executive, one employee with more than 3 years of service, and one employee with less than 3 years of service. Easy. The other thing to remember that's important to note is if the member doesn't spend all of their money, they can carry forward their balance to the next benefit year. After that, any forfeited funds can return to the plan sponsor. The plan sponsor can set up their benefit plan or their healthcare spending account in a number of different ways. They can have a carry forward provision, they could have no carry forward provision, or they can have an expense carry forward provision. Again, I encourage you to visit thebenefitstrust.com. I encourage you to take a look at the book that we have, the eBook that we have online. It explains all this, but the majority of people choose the balance carry forward provision in their healthcare spending accounts. Quite simply, if I've got a $10,000 healthcare spending account and I've got $8,000 that I've spent, I've got a $2,000 balance. That balance can be used to carry forward into the next benefit year, so I can use that money as I want, and it's added to the new monies that have gone into the benefit plan. Any money that I don't spend, let's just assume in year 2 I don't spend anything, so I've got $12,000 in that account, $2,000 carried forward plus another $10,000. Terrific. I've got $12,000 to spend, and let's just say for a moment, for illustration purposes, in year 2 I spend nothing. Then what happens is the $10,000 gets carried forward. The $2,000 that was carried forward can only be carried forward once. That's not spent. It goes back to the company and comes back to the company as income. It comes back to the plan sponsor as income. Well, the question often comes up is, what happens if I need more money throughout the benefit year? The healthcare spending account promise is made annually in advance. We don't set these rules. Canada Revenue Agency sets these rules. Part of the risk is, I'm going to set an amount, but the promise is made annually in advance, and there's an element of risk there. What if my expenses exceed that, but the promise is made annually in advance? Well, too bad, so sad, so to speak. The healthcare spending account promise is made annually in advance by the plan sponsor. Who are some great prospects for this type of a benefit plan? Well, owner-operators of businesses, without a doubt, professionals, without a doubt, contract workers. I just had a conversation this morning with a broker who's working with a group. They've got 40 employees in their organization, but they have about 75 contractors, 85 contractors in their association, and they want to keep those contractors happy. So they're looking at ways of giving these contractors a healthcare spending account without having to come back and bite them in the butt, so to speak. So contract workers are great recipients of healthcare spending accounts. Insurance advisors. Many insurance advisors that are out working are out working independently, and they need you need a benefit plan. So insurance advisors are great prospects. Executive teams, that C-suite like I was talking about. One thing that's important to know as well is insurance advisors, we've got an arrangement going where we will only charge you a 5% administration fee for your particular account. Obviously, there's no commissions in that, but you don't want to get commissions on your own coverage. So if you are an insurance advisor and want a healthcare spending account, we'll set you up with a 5% advisor special administration fee. So when we're talking about healthcare spending accounts, and we're talking about healthcare spending accounts with that smaller employer, that 1- and 2-person group, some of the biggest objections we get are quite simply, well, you know what? Not necessary. My spouse has a benefit plan. My spouse has a benefit plan. I don't need one. Well, I don't care if your spouse is a teacher. I don't care if your spouse works for Ontario Hydro or the OPP or York Regional Police or whatever the circumstances are. Your spouse's benefit plan often doesn't cover all of your family's expenses. There are things that are not covered by your spouse's benefit plan. For example, Things like orthodontia often are not covered or are restricted in a certain way. People run out of paramedical expenses because it's $300 per practitioner or $500 per practitioner, and someone goes to get athletic therapy all the time or massage therapy. So even though your spouse has a benefit plan, the executive shouldn't be reaching into their pocket at all to pay for expenses because it's after-tax dollars. You want to be setting it up through a benefit plan, and a healthcare spending account is always the second or last payor in this case. Use your spouse's plan first, use this plan second for additional expenses. So as I like to say, this plan can be used as a primary plan, or it can be used as a supplemental plan covering additional family expenses. And that's where it's used the majority of time, covering additional family expenses. So for coordination of benefits, healthcare spending accounts always pays last. So great, you walk into a company and it's a doctor or it's a lawyer or it's an engineer that's working independently, and they might have one employee, and you're saying, hey, great, we can set up a benefit plan for you. And it says, hey, we're covering my I don't need a benefit plan because my spouse has a benefit plan. This is a great way to add on a benefit plan, and you give your employees some coverage as well. Commissions. So for this individual product that we have out on the marketplace, the commissions are built into the product, and the administration fees are 15%, including a 5% commission to you. No hidden fees, no additional fees, no monthly fees, no per check fees. It's just a 15% administration fee and a 5% commission built in directly for yourself. We do all of the administration. We set up the benefit plan, and we often get the question, well, terrific, how are claims paid? Well, we've got a number of ways to interact, but with a healthcare spending account, a drug card is not available. But what we've got is this terrific claims paying app on your smartphone. You download it onto your smartphone and you take a photograph of your claim. Within a moment of taking that photograph, you're going to get an email back saying we've received your claim, and then you're going to get an email back shortly thereafter within 24 hours saying a deposit has been made into your checking account or the account that you determined in advance in the amount of X with your explanation of benefits. As well as that, on your smartphone, you can check your healthcare spending account balance at any time, so you can see how much money you've got left in your healthcare spending account, or the employees can see how much money they've got left in their healthcare spending account. And again, this is all available on your smartphone. As well as that, we've got online claim submission. You can scan or email a claim if you want. People still send them in direct mail. And we've got the electronic dental interface, if you would, or EDI dental, so the dental office can send the claim directly to our office. So there's all sorts of different ways to claim, so we make it real easy. Our website has a ton of tools on healthcare spending accounts. It's got a ton of tools. Again, we encourage you to visit thebenefitstrust.com. Healthcare spending accounts can be just certainly part of your benefit plan or a lot of your benefit plan. It's entirely up to you. But there's a lot of tools on our website, and we encourage you to visit that, especially our eBook on the Smart Business Owner's Guide to Healthcare Spending Accounts. This is a book that you can send a link to a client. You can take this book, you can download it, you can print it off if you like. It's, I think, 20 or 30 pages. A lot of valuable information, a real easy read. And feel free to plagiarize it as much as you choose to. It's entirely up to you. We just want to help you sell more benefits. So this is something, it's interesting. It's a great way to create opportunities. And when I say create opportunities, be creative with your opportunities. So here's a guy building a treehouse, and it's a very creative treehouse. You can do the same thing. You can be very creative on how you sell these benefit plans, because that's what they are. They're benefit plans. A benefit plan is a promise between an employer and an employee. I've got send email blasts, be innovative. I've got a broker that I work with in Northern Ontario. And, whereas we're used to Southern Ontario, here in Toronto, the GTA, and when you go see a client, it might take you an hour to get to the client's place of business because of traffic and because of traffic and because of parking and so on. Well, up in Northern Ontario, they're traveling many, many miles because of the just vast distances. So what this particular broker does, it's really interesting. She works at a P&C shop, and all she does is sell these healthcare spending accounts to their small clients that are all over Northern Ontario. And she just sets up telephone meetings with them where they've got 15 minutes or 20 minutes in front of their computer. And she's doing that, setting up these meetings by email, and she's having a 15-minute or 20-minute meeting with them in front of their computer, and they're looking at this documentation online and completing all the forms online. So you can be very innovative as well. So it's entirely up to you. But the good news is this is a 10-minute solution. You can often sell these plans in 10 minutes. You can often have a conversation and a meaningful conversation on showing a client how they're going to pay for things in a tax-effective manner. They understand it, they get it, they see the value of the insurance, and they see how this works in under 10 minutes. It's a powerful way to continue to get your client's trust, to continue to build your client's trust, or to continue to get new clients so you can sell them other things after you've built up that trust factor. As I like to say, a conventional benefit plan takes an awful lot more work than selling a 10-minute solution. And when you're looking at some of the solutions that are available out there, they're either online. You can even get them at Costco. Costco's got an employee benefit program for individuals, and it's cumbersome and it's difficult to understand, and it's often very restrictive, but you've got to do a whole bunch of comparison. Here we're saying, hey, what are your expenses? Let's look for a tax-effective way to pay for those expenses, and let's give you a little bit of added protection should something catastrophic happen if you're traveling outside of the country or the province for that matter, or if you've got all of a sudden a new large in Canada claim, we've got your back for that as well. So it's a very powerful way to get to yes. It's a very powerful way to quickly get to no, and it's also keeps you away from maybe. As I like to say, yes pays you, no teaches you, and maybe kills you. So you want to stay away from maybe. So the key thing to remember with healthcare spending accounts and with us, the Benefits Trust, is we help successful business owners build a better benefit plan than they can get anywhere else. And it's interesting when you look at that approach, the successful business owner may only have one employee, they may have 2 employees, they may have 100 employees. But what we do is we keep promises that employers make to employees with respect to their benefits, and we help successful business owners build a better benefit plan than they can get anywhere else. Simple as that. So this has been a quick session today on healthcare spending accounts. We spent just under an hour, about 50 minutes together. We want to thank you very much. Again, apologies for Mike Ignatz. He couldn't be here today. Feel free to reach out to us if you have any questions, any thoughts, any concerns, or you'd like to discuss this further or look at some creative ideas on how to sell more healthcare spending accounts. We'd be happy to talk to you about it. Reach out to us and say hello. As well as that, at the end of the session, you're going to be sometime today, later on today, you're going to be receiving an email. Please complete that email, send it back to us, and you're going to receive a complimentary copy of our monthly Trusted Advisor newsletter, again, electronically, as well as blogs from time to time on various subjects. And as well as that, you're going to get your CE credit sometime over the next couple of weeks. So thank you very much for your time. I greatly appreciate it. On behalf of all of us here at the Benefits Trust, we want to wish you a great selling day ahead of you and wish you all the best in 2018. Check our website out, thebenefitstrust.com. We've got a number of other CE certificate opportunities available. And again, we'd love to hear from you, so feel free to reach out with any questions. Have a great day. Bye for now.